What if the single most important piece of health information about your body has been sitting in your wallet this entire time, and nobody ever told you how to read it properly? Not for emergencies, not for surgery, but for your long-term survival, your cognitive sharpness, your heart, your gut, your energy as you age. I'm talking about your blood type. And before you think you already know where this is going, I promise you, what I'm about to share is not what most physicians discuss during a routine checkup. It is not what the internet tells you when you search blood type health, and it is almost certainly not what you were taught in school. Stay with me through every section of this video because toward the end I'm going to reveal one critical factor, something completely separate from the letters on your blood type card, that determines whether any of this actually applies to you in a meaningful way. Miss that part, and you only have half the picture. My name is Dr. Katherine. I've spent over 2 decades working in internal medicine and preventive health, and one of the most consistently underused tools I encounter in patient care is blood type biology. A landmark study out of Harvard, 20 years of data, nearly 90,000 participants, confirmed what researchers had been building toward for decades. Your blood type is not a random biological footnote. It is a detailed map of your specific risks, your specific strengths, and your specific biological needs. And the overwhelming majority of men over the age of 45 are sitting on this map, completely blind to what it contains. Today, we are going to go through each blood type, O, A, B, and AB. And for each one, I will explain the science and then give you the exact protocol that matches your specific biological profile. Not generic advice written for the mythical average human, who, by the way, does not actually exist in any laboratory on Earth. Your neighbor might be type O, you might be type A. What protects him may do nothing for you, or worse, may actively misdirect your attention away from the risks your body is actually carrying. Let's fix that, blood type by blood type. Type O. Let's begin here because this is the oldest blood type in recorded human history, emerging approximately 50,000 years ago in early hunter-gatherer populations. And it carries a cardiovascular profile that modern medicine is only now beginning to properly appreciate. Here is the mechanism. Type O blood naturally contains lower concentrations of a clotting protein called von Willebrand factor. What that means in practical terms is that type O blood flows more freely through the vessels. The tendency to clot, the tendency for blood to thicken and stick and create blockages, is measurably lower in type O individuals than in any other blood group. The Harvard data put a number to this. Type O individuals carry approximately 20% lower risk of coronary heart disease compared to every other blood type. That is not a marginal difference. That is structural cardiovascular protection that was written into your biology before you took your first breath. If you are type O and you have never been tested for H. pylori, that conversation with your physician needs to happen soon. The test is simple: a breath test or a stool antigen test. Inexpensive, non-invasive, and for type O individuals, genuinely important preventive medicine. Your type O protocol. Movement is not a lifestyle preference for you. It is a biological requirement. Type O carries the highest baseline levels of dopamine and norepinephrine of any blood group. Your nervous system was engineered for physical output. When that output is absent, those neurochemicals have nowhere to go, and the result is restlessness, irritability, disrupted sleep, and over time, real metabolic disruption. 30 minutes of walking daily and resistance training at least twice a week will do more for your long-term health than most supplements on the market. Protect your gut actively. Limit anti-inflammatory drugs like ibuprofen and aspirin unless they are medically necessary. These compounds irritate the stomach lining in everyone, but in type O individuals, that irritation lands on tissue that is already more vulnerable to bacterial damage. Add fermented foods to your routine. Kefir, kimchi, plain yogurt, sauerkraut, 2 to 3 servings weekly actively supports the gut microbiome and creates a less hospitable environment for harmful bacterial colonization. Your cardiovascular system is your greatest biological asset. Your gut is your most important area to protect. Honor both. Type A. This blood type emerged roughly 20,000 years ago as human civilization shifted from nomadic hunting to settled agriculture. Closer living quarters, shared food sources, far greater exposure to viral illness. The immune system evolved accordingly, developing some of the most aggressive antiviral responses of any blood group. In youth, this is a genuine advantage. Your immune system mounts early, mounts hard, and clears viral threats efficiently. But this same immune profile comes with a significant trade-off that compounds with age. Type A blood has statistically higher coagulation activity. The platelets are stickier. The clotting factors are more active. Research published in Circulation, one of the world's most respected cardiology journals, identified that type A individuals carry approximately a 23% higher risk of heart attack compared to type O. But there is a second layer to this story that is equally important, and it is the one most physicians never connect to your blood type. Type A carries the highest baseline cortisol output of all blood groups. Cortisol is your primary stress hormone. In short-term situations, a sudden threat, a demanding deadline, a physical challenge, cortisol is your ally. It sharpens focus, mobilizes energy, and gets you through the crisis. But chronically elevated cortisol, running at high levels day after day, week after week, year after year, is a slow and systematic attack on your cardiovascular system. It inflames the inner lining of your blood vessels. It impairs insulin sensitivity. It disrupts sleep architecture, and it accelerates the kind of arterial aging that most men don't notice until they are sitting in an emergency room. Here is the precise mechanism that matters most for type A. Cortisol progressively damages the endothelium, that thin, delicate inner membrane that lines every blood vessel in your body. When that lining becomes chronically inflamed, when it loses its natural elasticity and smoothness, it becomes the exact surface that type A's already stickier platelets are most likely to cling to. That combination, chronically elevated stress hormones on top of an already heightened clotting tendency, is why type A cardiovascular risk is not just elevated, but specifically targetable. You can address both variables. Most type A individuals spend their entire adult lives never realizing that stress management is not a soft wellness concept for them. It is direct cardiovascular medicine. It is as important to your heart as controlling your blood pressure or your cholesterol. Treat it accordingly. Your type A protocol. Monitor your blood pressure every 6 months, not annually. Cortisol-driven vascular pressure builds gradually and silently, and catching the early upward trend is far easier to reverse than waiting for it to become a clinical problem. Build a daily cortisol reset practice. This does not need to be elaborate. 10 minutes each morning without your phone. Breathing deliberately, 4 seconds inhaling, 6 seconds exhaling, until your nervous system physically downshifts. What matters is daily consistency, not duration or complexity. 5 minutes every single day is more effective for cortisol regulation than 1 hour on a Saturday, because cortisol management is a daily biological process, not an event. At your next blood panel, ask your physician to check your homocysteine level. Type A individuals tend toward elevated homocysteine, an amino acid that, when chronically high, actively damages the inner walls of arteries. The intervention is straightforward: folate, B12, B6, through leafy greens, eggs, and legumes. Inexpensive, consistent, and targeted directly at one of your most specific genetic vulnerabilities. Type B, the metabolic generalist. Type B emerged approximately 15,000 years ago among nomadic populations traversing the shifting climates and food environments of Central Asia. Constant movement, constantly changing diets. The body adapted by developing the most metabolically flexible immune system of any blood group. Type B can efficiently process animal proteins, fermented dairy, a wide variety of grains, and an extensive range of plant foods, without the inflammatory reactions that other blood types sometimes generate. This is a remarkable biological advantage. Where type O might struggle with certain grains and type A might respond poorly to specific animal proteins, type B adapts. It reads a wide range of food inputs as safe, useful, and processable. In a world of nutritional variety, type B is genuinely well-equipped. Your type B protocol. Check your C-reactive protein, your CRP, annually. This is your primary inflammatory marker, and for type B individuals, it is the most important number on your blood panel outside of your basic metabolic markers. A reading above 1 milligram per liter without an active infection points to chronic low-grade inflammation, and finding its source is the priority conversation to have with your physician. Reduce processed food intake aggressively. Every health professional tells everyone this, but for type B, it is not generic advice. It is specific to how your immune system processes those inputs differently from other blood types. Rotate your food sources intentionally. Variety is not just acceptable for type B, it is biologically optimal. Your metabolic flexibility was designed for diverse inputs. Use it. For physical training, moderate sustained activity works best. Swimming, cycling, hiking, brisk walking. High-intensity training without sufficient recovery tends to spike inflammatory markers in type B individuals more sharply than in other blood groups, something worth factoring into how you structure your fitness routine. Type AB. I want you to pay careful attention here because this section carries the most urgent information for anyone watching over 50. Type AB is the youngest blood type in human evolutionary history, appearing approximately 1,000 years ago as Type A and Type B populations began interbreeding. In evolutionary terms, 1,000 years is almost no time at all. Type AB inherited immune tolerance from both parent blood types, and one meaningful benefit of that tolerance is reduced inflammatory immune activity in the gastrointestinal tract, which translates to measurably lower risk of certain gastric and colorectal cancers. In that specific domain, type AB carries genuine protective value. But here is the number I need you to sit with for a moment. Type AB individuals carry an 82% higher risk of cognitive decline and memory impairment compared to Type O. 82%. Let that land. The mechanism is cerebral microcirculation. The coagulation profile inherited from its Type A lineage creates subtle, cumulative changes in blood flow through the brain's smallest and most delicate vessels. Changes that build over decades, often invisibly. Not large, dramatic blockages. Micro-changes occurring in vessels smaller than a human hair, year after year, gradually reducing the efficiency of blood delivery to the brain regions most responsible for memory formation, processing speed, and executive function. This is what researchers call small vessel disease, and it is one of the primary biological drivers of age-related cognitive decline, including vascular dementia. And the critical fact about small vessel disease is this. It is largely preventable through the same habits that protect your cardiovascular system. The brain and the heart share the same solution. Every choice you make for your blood pressure, your cholesterol, your blood sugar is simultaneously a choice you are making for your cognitive future. Your Type AB protocol, treat brain health and heart health as one unified mission, because for your blood type, they are. Blood pressure control, blood sugar stability, and cholesterol management are not just cardiac strategies. They are your primary cognitive protection plan. Omega-3 fatty acids, specifically DHA, directly support cerebral blood flow and reduce neuroinflammation. DHA integrates into the cell membranes of your neurons, keeping them fluid and communicative. When DHA levels are inadequate, neuronal signaling degrades, and the inflammatory processes contributing to small vessel damage face reduced biological opposition. 2 servings of fatty fish weekly, salmon, mackerel, sardines, or a high-quality fish oil supplement discussed with your physician. Sleep is non-negotiable for Type AB. During deep sleep, your brain's glymphatic system activates and clears metabolic waste products, including the amyloid proteins associated with Alzheimer's disease. When you sleep fewer than 6 hours consistently, that clearing process is incomplete. Residue accumulates. Long-term studies show that Type AB individuals who chronically sleep under 6 hours display accelerated cognitive decline markers compared to those sleeping 7 to 8 hours. For your blood type, 7 to 8 hours of quality sleep every night is arguably your single most impactful daily health behavior. And finally, challenge your brain deliberately and consistently. A new language, a musical instrument, complex reading, strategic games requiring sustained analytical engagement. Cognitive reserve is real and measurable. Neural redundancy built through genuine intellectual challenge compensates in meaningful ways for the circulatory changes your blood type may create over decades. Now I need to address something that the majority of blood type health discussions skip entirely, the Rh factor. That plus or minus after your blood type letter is not decorative. Approximately 85% of people are Rh positive. The remaining 15% are Rh negative, and the biological difference is worth understanding. Rh positive individuals appear to carry moderately stronger baseline resistance to certain persistent ancient pathogens. The Rh antigen plays a functional role in how the immune system recognizes and responds to long-standing infectious threats. Rh-negative individuals show a subtly different cytokine signaling profile, meaning the immune system's chemical communication operates at a different baseline. Different does not mean inferior, it means different. Some Rh-negative individuals display heightened sensitivity to inflammatory triggers, which means that if you are Rh-negative and managing any chronic inflammatory condition, the anti-inflammatory protocols described throughout this video become even more relevant to your specific profile. Know your complete blood type, the letter and the Rh factor, and make sure your physician has both on record and in context. Now, stop. This is the part I told you to wait for, because everything I have shared today is real. The type O cardiovascular advantage, the type A cortisol and clotting risk, the type B autoimmune tendency, the type AB cognitive vulnerability, all of it comes from large, peer-reviewed, long-term population studies. But here is what those same studies also demonstrate clearly. For at least 50% of individuals, blood type alone predicts almost nothing about their actual personal health outcome. Genetics loads the weapon. Daily habits determine whether it ever fires. I have seen type A patients with exceptional cardiovascular health well into their 70s because they walked consistently, managed stress deliberately, slept 7 hours, and ate with intention. Their higher clotting tendency never became a clinical event. I have seen type O patients with severe gastrointestinal disease because they spent 30 years ignoring every signal their body sent them. And I have seen type AB patients in their mid-70s with sharper cognitive function than men 15 years younger. Not because their genetics were somehow different, but because they used their blood type as a roadmap rather than a verdict. They slept 8 hours. They ate fatty fish twice a week. They kept their blood pressure consistently below 120/80. They kept learning genuinely new and challenging things year after year. The statistical risk was still real, but they chose to address it systematically long before it became a crisis. That gap between genetic risk and actual outcome is precisely where your choices live. Risk is a probability. It is not a sentence. The man who hears he is type AB and says, well, I suppose cognitive decline is just coming for me and does nothing, is using this information as a reason for resignation. The man who hears he is type AB and says cerebral circulation is my primary vulnerability, so DHA, sleep, blood pressure, and deliberate cognitive challenge are my core daily priorities. That man is using the same information as a precision tool. Same blood type, completely different trajectory. Here is your complete summary. Type O, protect your gut above everything else, get tested for H. pylori if you have not already, and move your body consistently. Your cardiovascular system will do the rest. Type A, cortisol management is cardiovascular medicine specific to your blood type. Build a daily reset practice and check your homocysteine at your next blood panel. Type B, monitor CRP annually, reduce processed food deliberately, rotate your diet intentionally, and choose moderate sustained exercise over high-intensity training without recovery. Type AB, treat cardiovascular health and brain health as the same mission. Prioritize sleep as your most important daily health behavior, get your omega-3s, and challenge your mind with genuine complexity every single week. And regardless of your blood type letter, know your Rh factor, and make sure your doctor does too. One last question before you go. What is your blood type? And does the profile I described today match what you have actually experienced in your own health history? Write it in the comments. I read everyone, and the patterns that emerge from those conversations directly shape the topics I cover next. If this kind of evidence-based, blood type-specific health approach is what you have been looking for, subscribe so you do not miss what comes next. Every video on this channel is built the same way. Real research, practical protocols, no filler. Your body has been carrying this map your entire life. Now you know how to read it. I am Dr. Katherine. Take care of yourself. You only get one body. And now you understand a little more precisely how yours works.